Good afternoon, and thanks very much for coming along to this session. We're happy to see so many of you here. The IT system may or may not come along nicely with us, but we have three fabulous speakers who are going to cope no matter what happens to the system. We have started a little late due to some of the important functions that took a little longer than expected this morning. The organisers say that we still do have our allotted 1 hour, so our 1 hour is starting now. We have three fabulous speakers, and if it's okay, I might just introduce all three speakers first. Each of them are going to have 10 minutes to give their presentations, and then we'll have adequate time for question and answer at the end. My name is Robin Alders. I've been working with food and nutrition security for several years, currently working with the Centre on Global Health Security at Chatham House and primarily on a livestock and aquaculture policy. But our key folk for this session, we have Dr. Gunaratna, who conducts research to develop and evaluate multisectoral interventions, particularly those involving agriculture, that can equitably and sustainably improve nutrition and health at scale in developing countries. With a focus on Africa, she has conducted randomized studies and surveys on the effectiveness, consumer acceptance, and strategies for promotion and scaling of nutrition-sensitive agricultural technologies, evaluation of large-scale integrated agriculture and nutrition programs, and clinical trials on interventions to reduce the risks of adverse health outcomes among infants, young children, adolescent girls, women of reproductive age across resource-poor settings. So, welcome to Dr. Gunaratna. Our second speaker is Hassan from Nigeria. He holds a PhD in agricultural economics from the University of Ilorin, Nigerian. He is currently associate professor at the Federal University, and he has served as a consultant to the Independent Evaluation Group of the World Bank and collaborated with IFPRI on numerous research projects in northern Nigeria. His research interest is on household food security and production economics. He's the Deputy Director of the Centre for Innovation and Development and also Director of Academic Planning at your university. Do you sleep? It's amazing. Our third speaker is Haile Tesfaye. He's a research project coordinator at the International Potato Centre based in Ethiopia. He received a bachelor's degree in agricultural economics from Haramaya University, Ethiopia, and a master's degree in natural resource management and sustainable agriculture from Norwegian University of Life Science. He received his PhD in development economics from the University College of Cork in Ireland. He is interested in impact evaluation of food and nutrition projects using advanced quantitative methods, household modelling for agriculture, nutrition and health linkages, and economic cost-benefit analysis. So three excellent speakers. So without further ado, I'll ask Nilupa to move over to the podium.
Conducted in rural Ethiopia, that's better, looking at the influence of poultry production on women's diets in that country. So I want to start out by just acknowledging the many people who worked on this project, both in the United States, in Ethiopia, and in South Africa, and especially recognize two who are also here at the conference, Dr. Ramya Ambikapathy and Simone Passarelli, who also have posters here that hopefully you've had a chance to see. So there has been a lot of excitement about poultry and the possible contributions to diet and nutritional outcomes in rural environments. And while that's the case, the evidence has been somewhat limited on those actual impacts. When poultry has been examined, it's usually been done in conjunction with with home gardening or other kinds of intervention packages. So it's hard to tease out the effects of poultry in particular. A couple of years ago, there was a rather exciting study in Ecuador in which eggs were provided to very young children once a day for 6 months. And that study found some rather marked increases in linear growth of those children. But follow-up of the same children just conducted quite recently found that those effects disappeared. And a similar in a study that was conducted in Malawi to kind of reaffirm those results also found a lack of effect on linear growth. So the question really is, in a rural setting, can chicken production improve diets and ultimately nutrition? And can that happen alone or in conjunction, or does it need to be done in conjunction with some sort of social and behavior change type intervention that focuses on nutrition? So can agriculture work passively, or does it need an explicit nutrition strategy? So we looked at two different interventions that were being implemented in Ethiopia. The first was implemented by ILRI, the International Livestock Research Institute, and they worked on households in the rural settings that were already producing chickens in a sort of backyard, small-scale manner, and then provided those families with improved chicken strains, 25 vaccinated birds per household, as well as some promotion and technical support to encourage good management practices. This was actually an on-farm trial looking at the benefits of exotic genotypes, and we use that as a way of looking at poultry intensification as an intervention. The second intervention was coordinated by Fanarpan out of South Africa, and they developed a program of social behavior change intervention that looked at diets, nutrition, wash, women's empowerment, and home gardening. And this was implemented through the Ethiopian Institute of Agricultural Research, EIAR, and there they had local staff who were trained and lived within the communities and developed and implemented a package of messages around nutrition and diet and other topics. They also provided vegetable seed to encourage home gardening, and these were the crops that were shared. Those were the priority crops for EIAR for the country. So, so the study was conducted in the four main regions of Ethiopia, the most populous regions. They were in 20 different districts that were identified as being high poultry producing districts, and those districts served as strata from which we sampled villages. The design was a cluster-randomized trial, so we had 60 villages in total, and every village was allocated to either a control group of no intervention, a group which received only the poultry intervention, or a group that received both the poultry and the nutrition intervention. At the household level, the inclusion-exclusion criteria identified families who were small-scale chicken producers, who had a woman of reproductive age, who was willing to participate in our study for the duration. So the implementation was really quite a challenge because we had different partners doing different interventions, as well as a third team that did the evaluation, which is what I'm talking about. The distribution of chicken genotypes took much longer than expected because of the biosafety and regulatory requirements in the country. So while that was happening, shortly afterwards, the nutritional intervention was implemented in the selected villages, and that went on for 14 months. Shortly into that intervention, vegetable seed was disseminated. In terms of evaluation, we visited families kind of before in a baseline, a midline, and end line after the interventions. And while all of this was happening, these are rural areas, there's a lot of seasonality, there's both short and long rains, so there's an additional factor there. We were interested in women's dietary diversity as a primary outcome, with the thinking that that indicates in some way micronutrient intake, which ultimately leads to nutritional status. That was the rationale. And the intervention sought to increase both poultry production and management practices, and with the nutritional complement, various types of behaviors as well as vegetable production. And then the thinking there is that we either create increased direct access to nutritious foods, increased income through their sale, or depending on the management practices, either increase or decrease exposures, especially to fecal contamination. And as we've been talking about all week, women's empowerment and the degree of gender equity within these families is both a mediating and a modifying factor for this whole story. So we had 2,117 households that were enrolled and followed over 3 time periods. Loss to follow-up was about 4%, so that was not bad. The households were typical of rural areas in Ethiopia. The households are fairly large, the land owned is relatively small, there's a high degree of poverty, although slightly less poverty than maybe in the general population because these families were poultry owners to begin with. So these are the results. The primary outcome is really looking at women's dietary diversity. The vertical axis here is the number of food groups eaten in either 1 day or 7 days. And what you see is that the dietary diversity is really rather poor. That was not surprising, but did improve over time. But if we look at differences in differences, what we find is that there is a small, the change within the joint intervention arm that had agriculture and nutrition, the blue line, increases slightly more than the other two. But these differences really are quite small in terms of dietary diversity. They translate into 0.2 food groups per week. So you have statistical, but perhaps not a practically significant result. Children's dietary diversity, we also looked at children under the age of 3. It increases, as we would hope, as children age, but there were no differences between intervention arms. Where there was maybe some differences when we looked at specific foods that were consumed. So if we looked at egg and meat consumption in women over 7 days, having the chicken intervention, either with or without the nutritional intervention, increased the odds of consuming eggs in a 7-day period. For nutritional outcomes, you would hope for more than that, but there was this change of increasing the access to chickens. A similar pattern's observed for meat consumption, but if you look at the axes, these are really quite small effects. That part is not statistically significant. So what exactly happened in this intervention? So these are the different interventions or different arms where we looked at the actual number of birds households had. And what you find is at the end of the intervention after 14 months, the poultry arms have a greater number of birds, but really not very many that are remaining. So it's not a large flock size that remains, and that was largely due to mortality or sale or slaughter of birds, which without the ability to replace those flocks. So the number of animals was low by the end. And if you look at the egg production and consumption, again, the poultry arms had higher egg production, but we're still looking at about 8 to 10 eggs per week for a fairly large household, and the majority of them are actually sold, leaving very little for individual consumption. Looking at a few other outcomes, we looked at an adapted version of the WEA to look at empowerment, and we do see some differences in the joint intervention arm in terms of women being able to provide input into various agricultural activities conducted by the household. Again, so there is some difference here between the arms, and that's promising, but again, relatively small effects. We also looked at exposure to fecal contamination and with the various different set of indicators for WASH. But I think the main story here is that even after intervention, we see quite a lot of animal-human contact, and that's an area for improvement. So just to summarize that rapid list of results, what we see is at best, after this intervention, really small effects on women's diets. Likely a longer-term intervention would benefit to really involve in the behavior change, but there are really 2 main challenges that come up as we analyze this work. And the first is that households are interested both in having poultry products for home consumption, but also for sale, that it's a very useful sale source of income. And so in order to meet the needs for feeding a large family in a way that would be nutritionally meaningful, as well as meeting the household's desire for income, we need a much larger amount of production than this sort of intervention encouraged. So to move away from this kind of semi-scavenging model to something that's more commercial. The other challenge was really the sustainability, to have households that are having improved genotypes of chicken but not having access to a supply of chicks or vaccination or feed, or in the case of home gardening, vegetable seed. All right, that's all. Thank you very much.